What if I told you that over 50% of 50-year-old men are dealing with the problem they're too embarrassed to talk about, even with their own doctors? Guys, we need to talk about something that's affecting millions of men right now, something that's destroying confidence in the bedroom, the boardroom, and everywhere in between. Erectile dysfunction isn't just about sex, it's about feeling less of a man. And the silence around it, that's making it even worse. In this episode of What Women Want, Chad and I talk with Dr. Erin Hubbs, a hormone specialist who's helped hundreds of men reclaim their confidence and their relationships. And here's what shocked me. There are solutions most guys have never even heard of. Not just pills that give temporary relief, but actual treatments that can remove ED from your life. Even if this isn't a problem you are currently challenged with, it may be an issue in the future, and you are not going to want to miss this episode, where Dr. Hubbs not only reveals why this problem is skyrocketing among even younger men, but also the hidden lifestyle factors making it worse, and the breakthrough treatments that are giving men their swagger back, often without a single prescription. If you've ever worried about performance, or you know someone who has, you need to hear this conversation. Let's break the silence and get some real answers. Please take a moment to like and subscribe to my channel to hear more tips to help you be more successful in dating and relationships.
Today, she brings a very special guest, Dr. Erin Hubbs. Celeste, welcome.
Thank you.
And Doctor, thanks for coming in the studio.
Thanks for having me.
All right, today we're going to talk about something that, at least I can only speak for me and my friends. I know a lot of guys that don't want to talk about this with anyone they know, but it's important to all of us, and that's erectile dysfunction.
It happens.
Yes, it does. And so what was your thought process in having the doctor come in to continue our discussion as we talk about relationships, dating, and everything that's a part of it?
Right. Well, it is such an important part of relationships, having that intimacy. And Dr. Hubbs is actually my hormone replacement doctor. And I was asking him about the services he offers at his clinic, and he was telling me about how he's helped so many men with ED. And I thought, there's so many men who don't know this information. They suffer silently.
Yes.
They're afraid to talk to their friends, their family about it, even their own doctors. And this information needs to be known. And I think your listeners will appreciate that. Yeah, so he's here with us today to tell us about all the services that are available for people who are dealing with this.
All right, Dr. Erin Hubbs is in studio. So, Doctor, let's start with this. What is erectile dysfunction?
So it's a general term, and there's a rating system, but it's basically the inability, for performance.
Yes.
And so there's different levels of that in degrees, and some of that is biological or physiological or psychological, but it's, basically the inability to get an erection.
Yeah.
For intercourse or for sexual activity.
Well, going back to what Celeste was talking about with gentlemen who don't want to talk about it or suffer in silence. I mean, what's been your experience with all the different guys that you work with getting over that stigma to where they can feel comfortable speaking to you and talking about their problems?
Yeah, I think in the beginning, it takes a while because I think, as guys, as young boys, we're taught that it's a private matter. And then, beyond that, if things aren't working, it gets even more private. And like Celeste was saying, men suffer in silence. We don't talk about it. We often get, prompted by our partners or something like that. And so I do get guys in, and it gets to be where I'll go through the visit, and almost at the very end, right as we're almost wrapping up, they might say, oh yeah, I want to mention I'm having some trouble with my libido or getting erections. And so it's a private thing to them, and it's embarrassing because, as we were mentioning off air, that it's a failure for men. It's looked as that, you get that elbow rib when you're young, you can't get it up, kind of thing. So you just start thinking that way. And I was talking to a friend the other day, we were laughing at how many names we have for the penis.
Yeah.
Heart and cardiac, we have a couple, but if you think about all the slang and all, so we really start to make it a priority and part of our identity. And I think that's where men's struggle is, because it is part of their identity, and now they can't get an erection. So now I'm less than a man. So it's tricky, but I guess I create a space that men feel more comfortable, because I have a lot of men coming to see me and telling me things that they honestly say, I've never told anybody this kind of thing. So.
Yeah. I think it's just super important that guys realize that it's common. And, I was listening to a podcast where the doctor was talking of a study, and I thought it was really interesting. They said it's basically 10% of in their decade. So 30% of 30-year-olds will have some form of ED, 50% of 50-year-olds. So it just shows how prevalent it is. And I don't think guys realize that.
Well, doctor, maybe you can walk us through the process. So when someone comes to see you and they tell you they're having a libido issue or they're having problems, like what, because there's so many things that encompass that or could be leading to that problem. So what's the process for how you start to work with them to identify what the issues are so that you can work with, you can, find a solution?
Yeah, there's a lot of variables. Getting and maintaining an erection physiologically requires a lot. So, the first thing I start thinking about, because I do mainly focus on hormones, is I run the hormone panel and see what's going on with that. Because if that's dysfunctional or not optimized, lots of things aren't going to work well, including erections. Blood pressure, heart stuff. So, there needs to be vasculature, the blood flow and oxygen flow into the penis. And if there's any issue with that, if I see a high blood pressure reading or I hear they're on different medications, we do that workup. But I ask a lot of questions. I'm asking about when did it start, how often, what their health habits are, what their diet's like, exercise, how much do they watch pornography, masturbation. All those things kind of add up to a story for me. And I can start to kind of understand, is this something deeper, physiological?
Yeah.
Or is this something that is mindset or more psychological? And there's different ways to approach both of those.
That's interesting on the psychological part. How much or how often do you come across someone who's maybe had a bad experience and then all of a sudden it starts to become a part of their thought process when they're in that type of moment, right? Where you're like,
often.
Yeah. Where you're like, it's going to happen again. And then,
then that performance anxiety. And
Yeah.
then, the next step, let's say a guy goes and sees a doctor and then he gets on one of the medications, Cialis or Viagra or something. Now they're setting up a thing where I can't get an erection without this pill.
Yeah.
So then that starts to create its own thing. So I start to back up further than that and work at a different level. And there's different procedures, depending on how far we need to go with how maybe serious or physiological it is, depending on what procedures. But a lot of guys, just changing some lifestyle habits can really clear up a lot. Communication, sex starts with communication. So I always encourage couples, and I do work a lot with couples, to start communicating, removing the shame, the guilt, any of that embarrassment, because that's a huge part of it.
Yeah, I can understand that for sure. I'm wondering too, with our lifestyles now, we seem to be, I can only speak for myself, but we're getting busier. We got a lot of different things going on, a lot of different stress points in our life, either with work or with kids or this activity or that activity. How often does stress become an issue with all the different things that guys have going on in their life that can impact their libido?
I think it's huge. I remember as a young kid, my dad would always say, stress is the real killer, and I just remember him stressed out at his job. And so they've done enough studies that show all the detriments of stress. So if we're stressed out and we're worried about that, and those stress hormones are getting kicked out and disrupting everything, and that takes our mind off things. We're preoccupied. I think a lot of the issues that when I listen to men, they're preoccupied. They're not really present. And so they're thinking about, like you said, bills and stress and work and kids instead of being present in the moment. And that's not helpful.
Which is why meditation is very helpful, isn't it?
Yeah, as I was mentioning before, just the basics. There's two general nervous systems, the sympathetic and the parasympathetic. Sympathetic is the fight or flight. We're busy, we're moving. And the parasympathetic is considered more rest, digest, relaxation. Erections come mostly from parasympathetic, from the resting. And so one of the things I tell guys, if you want better erections, meditate more. And I'm kind of tongue-in-cheek, joking a little, but I'm not, because there's tons of studies. And when we start slowing down, relaxing, which is the opposite of what happens when guys can't get erections. They get more nervous, more stressed. What can I do more? And they, try and come at it from more of that sympathetic. And a lot of times it's more of just relaxing, into.
Well, and Chad, you talked about past experiences and coming into, a situation where you've got that pent up, anxiety, and doing meditation along with visualization, a successful experience is probably super powerful.
Yeah, I can only imagine that, because if it happens once, and then let's say your wife is coming on to you and you think something's going to happen, in your mind, you'd be thinking, great, am I going to be able to perform? And I could just imagine the fear washing over your body in that moment.
Right.
That's horrifying.
And I have so much empathy for men that have had experience in the past and then they're dating somebody new and they're thinking, okay, it's getting serious now. We're going to get to this place and I'm not sure if things are going to work.
Yeah.
And then the fear around that, and will this person still want to hang out with me? So it's real.
Yeah. What about exercise, diet, like, strength training to maybe put a demand on your body to produce more testosterone, or exercise that can help with the blood flow, a healthy diet. How much do those positive factors help in that situation?
Huge. Yeah, a sedentary lifestyle we've shown across the board. So if we're sitting in a chair all day long, we're not moving. They're even starting to show where people sitting in heated seats, people driving around in their heat. That kind of is not helpful for movement. We want flow, and when things get stagnant, and so the standard American diet is higher in fat and carbs and a lot of that, and so definitely people aren't getting the right nutrient. They're not moving their bodies, so they're not getting that blood flow. Definitely.
Interesting. It's Dr. Hubbs, Aaron Hubbs, who is in studio right now along with Celeste, and we're talking about erectile dysfunction. I was just talking with, I think, my dad the other day, but pornography over the years has changed, because when I was younger, I remember walking into like gas stations or 7-Elevens or wherever, and you had to kind of go into the back of the store behind this darkened plastic. It was very taboo, right? Or you had to find some weird store in a weird part of town. It was difficult to find. But now all of us have access to any image we want in the palm of our hand with our phones. And I'm just wondering what the research shows in terms of pornography and the devastating impact it can have on erections, on your libido, and the impact that you're noticing with the people you work with.
Yeah, it's a great topic, and I think it's one that people want to avoid for lots of reasons. And when I look at this, I don't have any. I mean, I probably have some, but this isn't coming from moral judgment. I'm not judging any of my patients, any of my guys, or anything. But the evidence is clear. In my world, the first rule when I work with men: no porn. 100%. I get them to commit. Whether they do it or not, it's up to them. But I have them get off, because the studies have been shown, and it's just even working with people. It starts to retrain our brain. It gets very two-dimensional. We're looking at a screen. We're not looking at a real person. And so all the fantasies and all those things are taking us out of the present moment. A lot of men come, believe it or not, it's kind of like I was listening to your show before. People can compare themselves to a pro athlete. Men are comparing themselves to men, porn actors.
Yeah.
And they come in and feel less than because their penis isn't as big as the guys on porn. And so that's happening. But I have patients that I've worked with that married, love their wife. They've been married, 30 years. They can't be intimate. They can't get stimulated enough, because porn, they've shown, is just like drugs. That video worked today, it's going to need more tomorrow. So I have patients say, "Doc, it takes me 30 minutes just to find the right video."
And what were you talking about, the chemical impact? You were talking about dopamine. What's the impact that you get from the porn?
So what happens, just like we do when we're on Instagram, or we get that dopamine hit, somebody likes our post. Same with, porn, we get these huge dopamine hits. And so they're showing that, over ejaculation is going to decrease testosterone. Now they're showing that chronic masturbation while watching porn adds it to the next level, because now we're seeing these huge spikes in dopamine, where you cannot even tell, is that from watching porn or is that from doing cocaine? They're really comparing it. So it's
powerful,
very powerful. And then you get this trough, when all that goes away, it goes even down deeper. And so it's requiring you to kind of crawl out of that hole, so to speak. And so that's where this dependence kind of chemical connection happens, where it requires more and more of the video. And then they get home in real life and they can't get erections.
Here's my question. So you were talking about how it kind of rewires our brains. If you're working with someone who's been a chronic porn user, but they're able to break away from that, can you retrain the brain to, if you're able to stay away from that and find different ways?
Sure. Yeah, I think it's like anything else. We remove ourselves from, when somebody goes through a trauma, maybe they have PTSD, something like that. Yeah, so we can retrain, we can get away from that and just create healthy habits. And I think it's, like you said, it's ubiquitous. It's everywhere. We used to have to search for it more. And now, the latest research I was reading the other day, the worst, quote unquote, type of porn is the anime, the cartoon stuff, because they're not human. They can do anything they want in those and so they're showing that
is there really anime porn? My son is huge into anime. I've never heard of anime porn.
Yeah, I have some family I was working with, and the parents were really frightened because they found it. They found a lot of that on their teenager's computer or something, and so it's
which is why it's so important that we have these conversations with these young boys. My son's about to turn 13, and you don't want them to get in this habit. And it's, even if you talk to them, maybe you block their search ability to pull up porn, but then they have these friends who are going to be like,
I think the communication, my son's not going to hear this, so he's not going to get mad at me. So when he was younger, he's 18 now, but when he was younger and he's been dating the same gal for years, he came to me, and I'd already talked to my kids about a lot of things. I have 3 kids, and consent and a lot of those things that parents are talking to kids about. But he came to me when he was around 16, 17 and gave me a hug and said, "Dad, I want you to teach me about sex because I don't want to learn from porn." And I almost started crying. I gave him a huge hug and I said, "No dad has ever heard that." And so I think when you create that openness,
It's amazing that he said that to you.
it's amazing. And so I think when we leave it open, I don't shame or guilt. Anything's talkable within, for my kids. And so they feel trust that they can just bring anything up. And I think that's what's helpful, is just like Celeste said, creating a dialogue, because the thing you mentioned about it's going to happen one time, it's going to happen. These are, it's not that it's going to be perfect every time, just like in sports. Sometimes that team has a bad day.
Yeah.
Sometimes we're going to have a bad episode, sexual encounter, and that is okay. And as men get older, the chances of getting any form of erectile dysfunction increases, And so I think it's part of life that we have to understand. It could be a thing that happens occasionally, but there's a lot to do to make it just an occasional thing and not something that a guy has to live with and worry about every day.
And you were saying that a lot of men take
Cialis.
Cialis, kind of like a vitamin almost, just to help prevent that from happening.
Well, the low dose. So there's
the
a whole
low- yeah.
movement, and it's highly researched. And so instead of taking Cialis or Viagra, now there's the generic versions, prior to sexual activity, you can do it daily. And so 2.5 milligrams, and they've been studying this for a long time. And so the idea is that, again, I like to think of it this way: instead of creating that idea that I need to take this medication for an erection, I just have guys take it every morning, very low dose with their vitamins. And just to remind the audience, Cialis started off as a heart medication. And so it's very good for the heart, the prostate, all the things. Then its side effect was that guys were getting erections. So now it's off label to use for that. And so it's really good for lots of, organ systems of the body. So a lot of men, what Cialis does is it gently dilates the vasculature. And so athletes are taking it. Believe it or not, women are taking it, not for erections, obviously, but for the pump, for workouts.
Yeah.
Because it's increasing just that gentle flow. And so when guys take that low dose, it's helping all these other things, prostate a lot, heart and all that, but it's staying in their system because the half-life of Cialis is almost 24 hours, where Viagra is about an hour. And so it's, Viagra is quick, fast, it's done. Cialis stays in our system a long time, so a low dose is appropriate. And a lot of guys find it works great, and then they're not connecting that, thing. And so a lot of times medication is a great step just to see.
Is there anything negative to long-time usage of Cialis? That you
Not at
notice?
low dose.
Low dose.
Over 10 milligrams a day, 15 milligrams a day over a long time, desensitization, there can be some issues. But yeah, they haven't shown anything with the 2.5 to 3 milligram, which is considered.
And the gentlemen who are using the low dose, they enjoy it? They like that?
I would say almost all my guys are on it. Yeah.
Huh.
It's kind of one of those things that we start to talk in and we start to, their prostates, there's just things going on. And so it's just, I podcast yesterday, I said it's one of the most underrated medications. And so when you really study it, it's very benign. It's not harmful taken appropriately, but it's helpful for a lot of men.
That's terrific.
Absolutely.
All right. We got Dr. Aaron Hubbs in studio along with Celeste Trapp. We'll come back and we'll continue the conversation. It's great to have you in studio, Doctor. Thanks for your information, your insight.
Thank you.
And Celeste, have you talked to your son yet about
porn?
Yeah.
I have not had that conversation yet.
Okay.
Actually, I think his dad should be the one, don't you think?
Yeah, I would say
So
that.
maybe he has.
When I was younger, the last person I was going to go to ask questions about sex was my mom. I wasn't going to do that.
Right. Well, I don't even want to bring up anime porn because that's going to really pique his interest. So I might just leave that off the table.
But I almost feel like they're targeting the younger ones with that.
Yeah.
That's scary. So Celeste, give out the website real quick where people can catch past episodes of our
That's
conversations.
right. Chad and Celeste live recorded at my site, Celeste Trapp, CelesteTrapp.com.
All right, Doctor, walk us through some of the packages. For the guys out there listening who need your help, who are interested, walk us through your packages and how it works, the process.
Yeah, so there's different levels. And so, again, all guys, I'm working on diet, exercise, kind of the pillars of health, really getting to identify if they're misusing or overusing porn, all those kind of things. Some guys might just want to start off taking medication, that you can get generic, and a month's supply of Tadalafil, which is the generic Cialis, might cost you $10, $15. So that's, not cost prohibitive for that. So that might be a start. But when guys are having what I'd call moderate to severe, meaning that it's difficult to get an erection good enough for penetration, is kind of how we view that in the doctor world. There's different things. I was just mentioning a penis pump. And when people hear that, I get a lot of laughter. And when people see them in my clinic, it's kind of, goofy looking. But they're extremely therapeutic, and they're not meant to get an erection. That's not really the point. So some of the ones have a thing. You get an erection, then you're able to maintain that by putting a ring on or something. And this is merely to retrain, and so that's helpful just to get blood flow back in and get blood flow out. And so that, that's one of the tools. I have a machine that does shockwave therapy. And in Europe, they've been probably using this machine 30, 40 years for this. It's the same technology we got from how they use kidney stones, break up kidney stones. And so what happens is plaque buildup, just like we can get in our heart and other vasculature, we get these microplaques in the penis. And so this machine is a shockwave therapy, which sounds electrical. It's not, it's a sound wave type of thing. But that breaks up the plaques. And it also does another interesting thing called angiogenesis, where you'll have, one vessel and then it goes to two goes to four goes to eight. And so it really does amazing things by increasing the vasculature, so more oxygen flow. PRP, which maybe a lot of folks have
The athletes are big on that, the PRP
huge
injections, right?
I inject it in joints, I inject it all over, but I can also, and don't cringe too much, guys, because I'll numb you up, but inject that into the penis. So I draw the blood, get out the rich platelet factors and some of the nutrients. And it's amazing. I mean, the research is there. And so what I have learned is that if a guy comes in and just does the penis pump, some guys, that's amazing. I was just chatting that I had a guy tell me one time that, things are going pretty good. I'm not really concerned, but it used to be really good. And now I'm driving like a nice Cadillac and I want a Ferrari again. Yeah. And so all he did was use the penis pump 10 minutes a day. There's a protocol for it. And he came back the next visit smiling because he couldn't believe just that alone. It's kind of like you do some bicep curls. Eventually, you're going to, increase some biceps. And so what I started realizing that I didn't want to waste guys' time or money just on one procedure because they're not going to get what they're looking for.
Yeah.
And so I kind of honor and respect the man that comes in. That's a hard visit. Come to your doctor for that condition or that situation. And so I just let him know, you're already here. Don't waste your time just doing this and that. And so the package deal I put together starts off with the PRP treatment, and then I'll do 6 of those shockwave therapy. And then at the very end, maybe about 6 months later, I'll end that with another PRP treatment. And in between, they're using the penis pump, and then they're taking low dose tadalafil. And that package deal, I put it together because I saw so much effectiveness with it that, it's hard to regulate or manage expectations, but I probably, 90% success rate. I mean,
awesome.
It's pretty amazing. And so there's another condition where guys can get, it's called bronies, where there's a curvature. These techniques even can clear up that and really, and some guys, it's hard to even get in sexual positions because there's so much curvature of the penis. And that happens for different reasons, or sometimes we don't even know why. And so I found that putting that together takes out the guesswork. They don't have to, and I just, I found that leaving it up to them, they're probably not going to want to do a lot of it, but I packaged that way and lots of success.
That's great.
Yeah.
How can people get in touch with you?
So my clinic is Vim and Vigor Clinic. You can go to the website. It's off Macadam, South Macadam, right by Zupan's over there.
I know exactly where it's at. That's your place.
Macadam Plaza building. Yep.
I wanted to ask you this. It's got to be rewarding when you have a guy who's willing to come in, probably feels broken, and then you take them through your package, and then you're able to transform their life, and they have success.
It's one of my favorite things.
It's got to be awesome.
Yeah, I love it.
Because like you said, you're not just impacting one person, you're impacting their partner. That's a big deal.
And it goes even further, and a lot of guys will know exactly what I'm talking about. I had a guy that is a patient of mine, and he runs a huge company, hundreds and hundreds of employees, and he owns it. And so he would tell me that when he was having erectile dysfunction, that he would get up to talk to his staff and he felt like just this little man talking. He owns the company. And so I think that there's something that it's not that it just affects us and our partner. It kind of can infect the climate or the atmosphere around us because we don't feel as confident. We don't feel as courageous. We have, feel maybe timid. And so I think that it, affects a lot of people. So I get a lot of joy and reward just seeing that light go on and seeing guys, I call it their swagger.
Yeah.
They get their swagger back.
That's great.
Can you talk more about the hormone therapy that a lot of men have good results just with that alone?
Yeah. So for all kinds of reasons. And, they've shown that our food system, the water table they're disrupting hormones. It's not, a casual thing that it's actually causing. And so, the idea that a 30-year-old could come in with hormone issues is not surprising to me anymore. It used to be, but now I'm seeing it a lot more. And when I run their labs and check it out, they're clearly deficient.
Yeah.
It's not that they're just trying to get bigger muscles or, whatever guys are thinking about testosterone therapy. And so a lot of guys, if hormones aren't optimized, it's hard to be happy. It's hard to lose weight. It's
Yeah.
hard to have a lot of things because hormones drive the train. And so when guys come in, and I always tell them, there's no commitment, just come in and let's look under the hood. Let me run you through the labs. Let's go through all of the things and just see what's going on and then make an informed decision. But a lot of times when hormones are optimized, a lot of things, and including erectile dysfunction, can improve a lot. Because whether estrogen's up or down, testosterone for men, it can be a huge factor.
All right. Celeste Trapp, Dr. Aaron Hubbs in studio. His clinic is Vim and Vigor. It's right there off McAdam next to the Zupans. You can contact him and he'd be happy to help. I really appreciate you coming in and talking about a subject that is difficult to talk about for a lot of guys. But unlike a lot of doctors I've come across, you speak in a very, simple language, which is good.
Thanks, Chad.
He was terrific.
Glad to have him.
Thank you so much for your time.
Thank you.
Celeste, thank
All
you.
right. Thanks, Chad.